Picture this: you've spent 8 grueling years studying medicine, sacrificed countless nights of sleep, missed family gatherings, and pushed through the most challenging exams of your life. You finally earn the title doctor and walk into your dream job at a prestigious military hospital. You're ready to save lives, ready to prove yourself worthy of the white coat you've worked so hard to earn. But then, reality hits like a slap in the face. The senior doctors look at you like you're a child playing dress-up. Nurses whisper behind your back. Your suggestions are dismissed before you even finish speaking. And, when the most critical moments arrive, when lives hang in the balance in the operating room, you're told to step aside and watch from the corner like a student who forgot their homework. This isn't just about one young doctor's struggle. This is about a system that sometimes forgets that experience isn't the only thing that matters. Sometimes, fresh eyes see what tired ones miss. Sometimes, the newest voice in the room has the most important thing to say. But, what happens when that voice belongs to someone who refuses to stay silent? What happens when a general, a man who's seen real combat, real life and death decisions, walks into that same operating room and changes everything? This is the true story of Dr. Sarah Chen, a brilliant young surgeon whose journey from outcast to hero will make you question everything you think you know about respect, authority, and what it really means to save a life. Get ready for a story that will keep you on the edge of your seat, because sometimes the most powerful moments happen when the odds are stacked against you, and sometimes the most unlikely allies appear exactly when you need them most. Dr. Sarah Chen adjusted her pristine white coat for the 100th time that morning as she walked through the corridors of St. Matthew's Military Medical Center. The fabric still felt foreign against her shoulders, like wearing someone else's skin. At 26, she was the youngest doctor ever hired by the prestigious institution, a fact that seemed to follow her like a shadow wherever she went. The morning sun streamed through the hospital's tall windows, casting long rectangles of light across the polished floors. Sarah's sneakers squeaked slightly with each step, a sound that seemed unnaturally loud in the hushed atmosphere of the early morning shift. She clutched her coffee cup tighter, the warmth providing a small comfort against the knots forming in her stomach. 3 weeks. It had been 3 weeks since she started working here, and she still felt like an outsider looking in through frosted glass. The other doctors weren't openly hostile, but there was something worse than hostility in their polite smiles and careful nods. There was doubt. Every time she spoke up during rounds, she could see it in their eyes, the question mark that followed her name, the subtle pause before anyone responded to her suggestions. Sarah had graduated summa cum laude from Johns Hopkins, completed her residency at Massachusetts General Hospital with distinction, and had recommendations that read like love letters from some of the most respected surgeons in the country. But none of that seemed to matter here. Here, she was just the kid who looked like she should be studying for finals, not making life or death decisions. The irony wasn't lost on her. She had chosen to work at a military hospital specifically because she thought her skills would be valued over appearances. In civilian hospitals, she had faced similar challenges, but she had hoped that in a place where performance mattered more than politics, things would be different. She was beginning to realize how naive that assumption had been. As she approached the nurse's station, Sarah could hear the familiar sounds of the morning shift change. Monitors beeped steadily, phones rang with their distinctive hospital tone, and conversations flowed in the medical shorthand that had become second nature to her over the years. But, as she drew closer, the conversations seemed to quiet down, replaced by those same polite smiles and careful nods. "Good morning, Dr. Chen," said Nurse Patricia Williams, a woman in her 50s whose gray hair was always pulled back in a perfect bun. Patricia had been working at the hospital for over 20 years, and she had a reputation for being tough but fair. Sarah appreciated that Patricia, at least, seemed to treat her with the same professional courtesy she showed everyone else. "Morning, Patricia. How was the night shift?" Sarah asked, setting her coffee down and reaching for the patient charts that were waiting for her review. "Busy but manageable. We had 2 new admissions overnight. Sergeant Rodriguez came in with chest pains, but the EKG was normal and his troponin levels are good. We're keeping him for observation. And Private Murphy was brought in from a training exercise with a suspected broken wrist. X-rays confirmed it's a clean break. Dr. Harrison already looked at him and recommended casting. Sarah nodded, making mental notes as she flipped through the charts. She had learned to appreciate Patricia's thorough briefings. Unlike some of the other staff members who seemed to give her information reluctantly, Patricia treated her like a real doctor from day one. "Any word on Mrs. Davidson?" Sarah asked, referring to an elderly woman who had been admitted the previous week with complications from diabetes. Patricia's expression grew more serious. "She had a rough night. Her blood sugar levels have been all over the place despite the insulin adjustments. Dr. Henderson wants to see her first thing this morning." Dr. Richard Henderson. Sarah's stomach tightened slightly at the mention of his name. As the head of internal medicine, Dr. Henderson was technically her supervisor, and he made sure she never forgot it. He was a man in his late 50s with silver hair and the kind of presence that commanded attention when he walked into a room. He was also the person who seemed most skeptical about her abilities. Sarah had tried everything to prove herself to him. She stayed late to review cases, volunteered for the most challenging assignments, and made sure her patient notes were absolutely perfect. But Dr. Henderson seemed determined to find fault with everything she did. If she was thorough, he accused her of being slow. If she was efficient, he questioned whether she was being careful enough. It was an impossible situation, and Sarah was beginning to wonder if she would ever be able to win his respect. "Dr. Chen?" Patricia's voice brought her back to the present. "Dr. Henderson is looking for you. He's in conference room B." Sarah nodded, thanking Patricia before making her way down the hall. Conference room B was where the morning briefings were held, and she knew that Dr. Henderson would want to discuss the day's cases before rounds began. She took a deep breath, steeling herself for whatever criticism or challenges awaited her. The conference room was already occupied when Sarah arrived. Dr. Henderson sat at the head of the long table, his reading glasses perched on the end of his nose as he reviewed a stack of patient files. Beside him sat Dr. Marcus Webb, a surgeon in his 40s who had a reputation for being brilliant but arrogant. Dr. Jennifer Adams, a resident who had started just a few months before Sarah, sat across from them, looking as nervous as Sarah felt. "Ah, Dr. Chen." Right on time, Dr. Henderson said without looking up from his files. "Please, have a seat. We have quite a few cases to discuss this morning." Sarah took the empty chair next to Dr. Adams, offering her a small smile of solidarity. Jennifer was only a few years younger than Sarah, but her status as a resident meant that she was often treated with even more condescension than Sarah was. The two women had formed an unspoken alliance, supporting each other in small ways when the environment became particularly challenging. "Let's start with Mrs. Davidson, Dr. Henderson began, finally, looking up from his files. "Dr. Chen, you've been following her case. What's your assessment?" Sarah had spent considerable time reviewing Mrs. Davidson's file the night before, and she felt confident in her analysis. Mrs. Davidson is a 68-year-old diabetic with a history of poor glucose control. She was admitted with diabetic ketoacidosis, and, while we've stabilized her initial crisis, she's continuing to have significant blood sugar fluctuations despite insulin therapy. I think we need to consider that she may have developed some insulin resistance, or there could be an underlying infection that's interfering with her glucose metabolism. Dr. Henderson nodded slowly, but his expression remained neutral. "And what do you recommend?" "I'd like to increase her monitoring frequency and consider adjusting her insulin regimen. I also think we should run a comprehensive metabolic panel and check for signs of infection, particularly urinary tract infection, which is common in diabetic patients and can cause exactly these kinds of glucose control issues." Dr. Henderson made a note in his file. "Dr. Webb, what's your opinion?" Dr. Webb leaned back in his chair with the casual confidence of someone who had never had his expertise questioned. "I think Dr. Chen is overcomplicating things. Mrs. Davidson is elderly and has a long history of non-compliance with her medications. Sometimes the simplest explanation is the right one. She probably just needs better patient education and closer monitoring of her medication adherence." Sarah felt her jaw tighten slightly. She had specifically noted in Mrs. Davidson's chart that the patient had been taking her medications as prescribed and had been working with a nutritionist for several months to improve her diet. But she knew better than to challenge Dr. Webb directly in front of Dr. Henderson. "I appreciate that perspective, Dr. Webb," Sarah said carefully, "but I've reviewed Mrs. Davidson's medication history, and she's actually been quite compliant. Her family confirms that she's been following her prescribed regimen carefully. I think there might be something more complex going on here." Dr. Webb shrugged dismissively. "Family members aren't always the most reliable sources of information. Patients don't always tell their families when they miss doses or cheat on their diets." "That's true," Sarah acknowledged, "but, in this case, Mrs. Davidson brought all her medication bottles with her, and they show she's been taking everything as prescribed. Plus, her family has been actively involved in her care for months." Dr. Henderson was watching this exchange with interest, and Sarah couldn't tell if he was pleased that she was standing her ground or annoyed that she was disagreeing with a more senior doctor. The silence stretched on for several uncomfortable seconds before he spoke again. "Well, I think we can pursue both approaches. Dr. Chen, go ahead and order the additional tests you mentioned. Dr. Webb, please work with the nursing staff to review medication compliance protocols with the patient and her family. We'll reassess based on what we find." It was a diplomatic solution, but Sarah could tell that Dr. Webb was not pleased at being essentially overruled. He shot her a look that was decidedly unfriendly before turning his attention back to his own files. The meeting continued with discussions of other cases, and Sarah found herself in similar situations several more times. Each time she offered an opinion or suggestion, it seemed to be met with skepticism from one or more of the other doctors. Even when Dr. Henderson seemed to accept her recommendations, there was always a sense that she was being tested, that her ideas were being scrutinized more carefully than those of her colleagues. By the time the meeting ended, Sarah felt emotionally drained despite the early hour. She gathered her files and headed toward the door, but Dr. Henderson's voice stopped her. "Dr. Chen, could I speak with you for a moment?" Sarah's heart sank. She turned back toward the table where Dr. Henderson was still seated, his expression unreadable behind his reading glasses. "Of course, Dr. Henderson." He waited until the other doctors had left the room before speaking again. When the door closed behind Dr. Webb, Dr. Henderson removed his glasses and looked directly at Sarah. "Dr. Chen, I want you to know that I respect your medical knowledge and your dedication to your patients. Your academic credentials are impeccable, and your clinical instincts are generally sound." Sarah felt a small surge of hope. Maybe this conversation was going to go better than she had expected. However, Dr. Henderson continued, and Sarah's hope deflated like a punctured balloon. "I'm concerned about your tendency to overcomplicate diagnoses and treatments. Medicine is often about finding the simplest explanation that fits the facts. When you're constantly looking for zebras, you might miss the horses right in front of you." The reference to zebras was a common medical saying: when you hear hoofbeats, think horses, not zebras. It meant that common diagnoses were more likely than rare ones. But Sarah felt that Dr. Henderson was missing the point. She wasn't looking for exotic diseases, she was simply being thorough. "I understand your concern, Dr. Henderson," Sarah said, choosing her words carefully. "But I've always believed that thoroughness is better than assumption. In Mrs. Davidson's case, for example, the standard approach hasn't been working. It seems logical to explore other possibilities." Dr. Henderson nodded slowly. "I appreciate that perspective, Dr. Chen. But I also want you to consider that sometimes younger doctors can have a tendency to overanalyze situations because they want to prove themselves. Experience teaches us when to trust our initial instincts and when to dig deeper." The implication was clear: Sarah was overanalyzing because she was young and inexperienced, not because she was being appropriately thorough. She felt a familiar mix of frustration and self-doubt wash over her. Maybe Dr. Henderson was right. Maybe she was trying too hard to prove herself and missing obvious solutions in the process. "I'll keep that in mind," Sarah said, not trusting herself to say anything more without revealing her frustration. "Good. I know you want to succeed here, Dr. Chen. And I want you to succeed too." But success in medicine isn't just about being right, it's also about working effectively with your colleagues and earning their trust and respect. Sarah nodded and thanked Dr. Henderson for his feedback, but as she left the conference room, she couldn't shake the feeling that she was being criticized for doing her job well. She understood the importance of teamwork and collaboration, but she also believed that patient care should always come first. If being thorough and asking questions made her colleagues uncomfortable, wasn't that their problem, not hers? The rest of the morning passed in a blur of routine activities. Sarah made her rounds, reviewed lab results, and consulted with other departments on various cases. But, throughout it all, she couldn't stop thinking about her conversation with Dr. Henderson. She found herself second-guessing every decision, wondering if she was being too thorough or too cautious. It was during lunch break that she finally had a moment to step outside and clear her head. The hospital's small courtyard was one of the few places where she felt like she could truly relax. It was a quiet space with a few benches and some carefully maintained flower beds that provided a small oasis of calm in the middle of the bustling medical center. Sarah sat on her favorite bench and pulled out her phone to call her sister Emma, who lived across the country but always seemed to know exactly what to say when Sarah was feeling discouraged. "Hey, sis," Emma's cheerful voice came through the phone. "How's the new job going?" Sarah hesitated. She had been trying to stay positive in her conversations with family, not wanting to worry them or admit that her dream job wasn't quite what she had hoped it would be. "It's challenging," Sarah said finally. "Challenging how? Are the cases difficult? Is the workload too heavy?" "No, it's not that. The work itself is fine. It's just, I don't think the other doctors take me seriously. They treat me like I'm some kind of intern instead of a qualified physician." Emma was quiet for a moment. "Are you sure you're not just imagining things?" Sometimes when we're in new situations, we can be overly sensitive to criticism. Sarah had been asking herself the same question for weeks. Was she being too sensitive? Was she misreading the situation? "I don't think so, Em. Today in our morning meeting, every time I made a suggestion, it was questioned or dismissed. When Dr. Webb said essentially the same thing I had said about a case last week, everyone nodded like it was brilliant." "That sounds really frustrating. Have you tried talking to your supervisor about it?" "My supervisor is the worst one. He basically told me that I'm overcomplicating things because I'm young and inexperienced." Emma sighed sympathetically. "You know what, Sarah? You're one of the smartest people I know. You didn't get to where you are by accident. Maybe it's not about proving yourself to these people. Maybe it's about staying true to what you know is right and letting your work speak for itself." It was good advice, and Sarah knew that Emma was right. She had always believed in herself and her abilities, and she couldn't let a few difficult colleagues change that. But it was easier said than done, especially when she had to work with these people every day. "You're right," Sarah said, feeling slightly better. "I just need to focus on my patients and do the best job I can." "Exactly. And remember, you're there because you're good at what you do. The right people will recognize that eventually." After ending the call with Emma, Sarah felt a renewed sense of determination. She would continue to advocate for her patients and trust her clinical judgment, regardless of what her colleagues thought. If that meant being seen as difficult or overly thorough, so be it. But, as she walked back into the hospital, Sarah had no idea that her resolve would be tested in ways she couldn't imagine. The afternoon would bring a case that would challenge not just her medical skills, but her ability to stand up for what she believed was right in the face of overwhelming opposition. And it would all begin with a phone call that would change everything. The afternoon sun was streaming through the hospital windows when the emergency call came in. Sarah was reviewing lab results at the nurse's station when the familiar sound of the trauma alert echoed through the corridors. The sharp, urgent tone was one that every medical professional recognized instantly. Someone's life was hanging in the balance. "All available medical personnel to emergency room 3. All available medical personnel to emergency room 3. Sarah immediately dropped what she was doing and joined the stream of doctors and nurses hurrying toward the emergency department. Her heart was already racing with the familiar mixture of adrenaline and focus that came with medical emergencies. This was what she lived for, the moments when all the years of training and study came together to save a life. As she pushed through the doors of the emergency room, Sarah could see that something serious was happening. Several nurses were preparing equipment, and Dr. Harrison, the chief of emergency medicine, was barking orders to anyone within earshot. In the center of it all was a man in military fatigues lying on a gurney, his face pale and his breathing labored. "What do we have?" Sarah asked Nurse Williams, who was connecting monitors to the patient. "Sergeant David Thompson, age 34. Collapsed during a training exercise. Witnesses say he complained of severe chest pain and shortness of breath before losing consciousness. Vitals are unstable, blood pressure 90/60, heart rate 120, oxygen saturation 88%. Sarah moved closer to the patient, her trained eyes immediately assessing his condition. Sergeant Thompson was conscious but clearly in distress. His skin had a grayish pallor that she recognized as a sign of poor circulation, and she could see small beads of sweat forming on his forehead despite the cool temperature of the emergency room. "Sergeant Thompson, can you hear me?" Sarah asked, gently touching his shoulder. "I'm Dr. Chen. Can you tell me what you're feeling right now?" Thompson's eyes focused on her with difficulty. "Chest hurts," he managed to say between labored breaths. "Can't breathe right." Sarah nodded, her mind already running through possible diagnoses. The combination of chest pain, shortness of breath, and low blood pressure could indicate several serious conditions, but one possibility stood out in her mind: pulmonary embolism. A blood clot in the lungs could cause exactly these symptoms, and it was a medical emergency that required immediate treatment. "Has he had any recent injuries or surgeries?" Sarah asked Patricia, who was pulling up the patient's medical records on a nearby computer. "Nothing recent. He's generally healthy, no significant medical history." "But..." Patricia paused, scrolling through the records. "He did have knee surgery about 6 weeks ago. Arthroscopic repair of a meniscus tear." Sarah felt a chill run down her spine. Recent surgery was a major risk factor for pulmonary embolism. During surgical procedures and the recovery period afterward, patients were at higher risk of developing blood clots, especially in their legs. If one of those clots broke free and traveled to the lungs, it could cause exactly the symptoms Sergeant Thompson was experiencing. "Dr. Chen, we need to get him stabilized," Dr. Harrison called out from across the room where he was reviewing chest x-rays with another doctor. "What's your initial assessment?" Sarah took a deep breath. She knew that her next words would be scrutinized, especially given her recent conversation with Dr. Henderson about overcomplicating diagnoses. But she also knew that she had to trust her clinical judgment. "Based on his presentation and history, I'm concerned about pulmonary embolism. The combination of chest pain, shortness of breath, low blood pressure, and recent surgery fits the profile perfectly. I think we need to get a CT angiogram of his chest immediately to rule it out." Dr. Harrison looked up from the x-rays, his expression skeptical. "The chest x-ray looks normal, Dr. Chen. And his EKG doesn't show classic signs of PE. Are you sure you're not jumping to conclusions?" Sarah felt the familiar knot forming in her stomach, but she forced herself to maintain her professional composure. "The chest x-ray can be normal in pulmonary embolism, especially in the early stages. And, while the EKG doesn't show the classic S1Q3T3 pattern, that's only present in about 20% of PE cases. His clinical presentation and risk factors are what concern me." Dr. Marcus Webb, who had apparently been called down from surgery, stepped forward with his usual air of authority. "Dr. Chen, I think you're overreacting. The patient is stable, his vitals are improving with oxygen therapy. This looks more like anxiety or possibly a minor cardiac event. We should focus on the basics before we start ordering expensive scans." Sarah could feel her frustration mounting, but she tried to keep her voice calm and professional. "Dr. Webb, with respect, his oxygen saturation is still below normal despite supplemental oxygen, and his blood pressure hasn't improved significantly. Those aren't signs of anxiety. Sometimes young doctors see horses and assume they're zebras, Dr. Webb said with a condescending smile. Pulmonary embolism is relatively rare, especially in someone his age and fitness level. The zebra comment was a direct reference to her conversation with Dr. Henderson that morning, and Sarah realized that word of their discussion had already spread among the senior staff. She felt her face flush with anger, but she forced herself to focus on the patient. Dr. Webb, Sergeant Thompson had surgery 6 weeks ago. He's been relatively immobilized during recovery, and he's presenting with classic symptoms. This isn't zebra hunting, this is following a logical diagnostic pathway. Dr. Henderson appeared in the doorway of the emergency room, having apparently been called down to consult on the case. He surveyed the scene quickly before approaching the patient. "What's the situation?" he asked Dr. Harrison. "Sergeant Thompson collapsed during training. Dr. Chen is concerned about pulmonary embolism and wants to order a CT angiogram. Dr. Webb, and I think it's more likely to be a cardiac issue or anxiety reaction." Dr. Henderson examined the patient briefly, reviewing his vitals and listening to his lungs with a stethoscope. Sarah watched anxiously, hoping that he would see what she was seeing. "His lungs sound clear," Dr. Henderson said finally. "And his cardiac enzymes are normal." "I'm inclined to agree with Dr. Webb. I think we're looking at anxiety or possibly a minor cardiac event. Let's get an echocardiogram and monitor him for a few hours. If his condition deteriorates, we can reassess." Sarah felt like the floor had dropped out from under her. She looked around the room at the faces of her colleagues, Dr. Harrison, Dr. Webb, Dr. Henderson, and saw the same expression of patient tolerance that she had been dealing with for weeks. They were humoring her, waiting for her to accept their decision and move on. But Sarah couldn't move on. Every instinct she had was screaming that Sergeant Thompson was in serious danger. She had seen pulmonary embolism before during her residency, and she knew how quickly it could deteriorate from a manageable condition to a life-threatening emergency. "Dr. Henderson," she said, her voice steady despite the adrenaline coursing through her system, "I understand your assessment, but I really believe we need to rule out PE. A CT angiogram would give us a definitive answer, and if I'm wrong, we've lost nothing but time and money. If I'm right and we don't act quickly, Sergeant Thompson could die." The room fell silent. Sarah could hear the steady beeping of the monitors and the soft hiss of the oxygen flowing through Sergeant Thompson's nasal cannula. She could also feel the weight of everyone's stare, and she knew that she had just crossed a line by questioning the judgment of 3 senior physicians so directly. Dr. Henderson's expression was carefully neutral, but Sarah could see the displeasure in his eyes. "Dr. Chen, I appreciate your concern for the patient, but we have collectively agreed on a treatment plan. Sometimes being a good doctor means trusting the expertise of your colleagues and not second-guessing every decision." Sarah felt like she was standing at a crossroads. On one path lay professional safety, agreeing with her supervisors, avoiding conflict, and maintaining her tenuous position at the hospital. On the other path lay her conviction that she was right about Sergeant Thompson's condition and her obligation to advocate for her patient. "I understand, Dr. Henderson. But my obligation is to the patient first. If there's even a chance that Sergeant Thompson has a pulmonary embolism, don't we owe it to him to find out for certain?" Dr. Webb stepped forward, his patience clearly exhausted. "Dr. Chen, you're out of line. We've made a clinical decision based on our collective experience. Your job is to follow orders, not to question every decision made by doctors with decades more experience than you." Sarah felt her temper flare at the dismissive tone, but before she could respond, Sergeant Thompson's voice cut through the tension. "Doctor," he gasped, his breathing becoming more labored, "I can't, something's wrong. I can't catch my breath." Sarah immediately turned back to the patient, and her heart sank at what she saw. Sergeant Thompson's oxygen saturation had dropped to 84% despite the supplemental oxygen, and his blood pressure had fallen further. Most concerning of all, she could see a faint bluish tinge around his lips, a sign of severe oxygen deprivation. "His condition is deteriorating," Sarah announced, grabbing a stethoscope to listen to his lungs. "And I'm hearing some changes in his breath sounds. This is exactly what we'd expect to see if a blood clot was getting worse." Dr. Harrison quickly joined her at the patient's bedside, his expression growing more serious as he saw the changes in Sergeant Thompson's condition. "Increase his oxygen flow," he ordered one of the nurses. "And, get me another EKG." Sarah seized the opportunity to press her case again. "Dr. Harrison, his symptoms are progressing exactly as we'd expect with PE. We really need that CT angiogram now." But Dr. Webb wasn't ready to concede. His deterioration could be explained by anxiety or even a progression of his cardiac symptoms. "We don't need to panic and start throwing around expensive tests." Sarah couldn't believe what she was hearing. Sergeant Thompson was clearly getting worse, and they were still arguing about costs and protocols instead of focusing on saving his life. "Dr. Webb, with all due respect, this man's life may be in danger. The cost of a CT scan is irrelevant if it saves his life. And the cost of unnecessary testing and radiation exposure is also relevant, Dr. Chen. We can't just order every test that comes to mind because we're scared of missing something." The argument was interrupted by the arrival of another figure in the emergency room. Sarah looked up to see a man in military dress uniform approaching the patient's bedside. She didn't recognize him, but his bearing and the deference shown by the hospital staff suggested that he was someone important. "How is Sergeant Thompson?" the man asked Dr. Henderson, his voice carrying the unmistakable authority of military command. "General Morrison," Dr. Henderson said, his tone immediately becoming more formal. "Sergeant Thompson collapsed during training. We're currently evaluating his condition and determining the best course of treatment." General Morrison. Sarah had heard the name but had never met him. He was apparently a high-ranking military officer who took a personal interest in the welfare of the soldiers under his command. She had heard that he sometimes visited hospitalized military personnel, but she hadn't expected to encounter him in the emergency room. "What's the diagnosis?" the general asked, his gray eyes moving between the various doctors assembled around the patient. Dr. Henderson hesitated for a moment. "We're still determining that, General. The consensus is that it's likely a cardiac event or anxiety reaction. We're monitoring him closely and will adjust treatment as needed." "The consensus?" General Morrison's eyes found Sarah, who was still standing close to the patient's bedside. "Doctor, what's your assessment?" Sarah felt every pair of eyes in the room turn toward her. This was it, the moment that would define not just her career at this hospital, but potentially her entire future in medicine. She could agree with the consensus, avoid making waves, and hope that Sergeant Thompson's condition stabilized on its own. Or she could trust her training, her instincts, and her obligation to her patient. "General Morrison, I believe Sergeant Thompson may have a pulmonary embolism, a blood clot in his lungs. His symptoms and medical history are consistent with that diagnosis, and I think we need to get a CT angiogram immediately to confirm or rule it out." The silence that followed was deafening. Sarah could feel the disapproval radiating from Dr. Webb and Dr. Henderson, but she kept her eyes focused on General Morrison, trying to gauge his reaction. General Morrison looked down at Sergeant Thompson, who was still struggling to breathe despite the increased oxygen flow. When he looked back up, his expression was thoughtful but unreadable. "Dr. Chen, is it?" he asked, and Sarah nodded. "How confident are you in this assessment?" Sarah took a deep breath. "General, I can't be 100% certain without the CT scan, but based on everything I'm seeing, his symptoms, his surgical history, the way his condition is progressing, I believe there's a significant chance that's what we're dealing with. And if it is PE, every minute we delay treatment increases the risk of a fatal outcome." General Morrison was quiet for several long moments, his eyes moving between Sarah and the other doctors. The tension in the room was palpable, and Sarah could hear her own heartbeat in her ears. Finally, the general spoke. "Dr. Henderson, how long would it take to get this CT scan Dr. Chen is recommending?" Dr. Henderson looked uncomfortable. "General, we could probably get it done within the hour, but I want to emphasize that the clinical consensus here is that it's unnecessary. Dr. Chen is enthusiastic about her diagnosis, but she may be overlooking the more obvious explanations." "And what would happen if Dr. Chen is right and we don't act?" General Morrison asked. The question hung in the air like a challenge. Sarah knew that everyone in the room understood the implications. If Sergeant Thompson had a massive pulmonary embolism and they didn't treat it, he could die within hours. Dr. Webb cleared his throat. General, the likelihood of PE in this case is relatively low. We don't want to expose the patient to unnecessary radiation and contrast agents based on speculation. General Morrison's expression hardened slightly. Dr. Webb, I've been in combat situations where split-second decisions meant the difference between life and death for the soldiers under my command. In those situations, I learned to trust the people who were closest to the action and had the most direct contact with the situation. Dr. Chen has been with this patient since he arrived. What does your gut tell you, doctor? Sarah felt a surge of gratitude toward the general for asking the question that cut through all the politics and hierarchy. General, my gut tells me that Sergeant Thompson is in serious trouble and we need to act fast. I could be wrong, but I'd rather be wrong about ordering an unnecessary test than wrong about missing a life-threatening condition. General Morrison nodded slowly. Dr. Henderson, I want that CT scan ordered immediately. The order came with such authority that Sarah could see Dr. Henderson physically straighten up. Yes, General. Of course. Dr. Chen, please coordinate with radiology to get Sergeant Thompson scanned as soon as possible. As the room suddenly burst into activity, with nurses preparing to transport Sergeant Thompson to radiology and doctors coordinating the scan, Sarah felt a mix of relief and apprehension. She had gotten her way, but she knew that if the CT scan came back negative, her credibility, and possibly her career, would be seriously damaged. But, as she looked down at Sergeant Thompson, who was still struggling to breathe, she knew that she had made the right choice. Sometimes being a doctor meant taking risks for your patients, even when those risks put your own career in jeopardy. She just hoped that her instincts were as good as she believed they were. The next 30 minutes felt like the longest of Sarah's career. As Sergeant Thompson was wheeled toward the radiology department, she could feel the weight of everyone's expectations pressing down on her shoulders. The hallway seemed to stretch endlessly as they made their way through the hospital, the only sounds being the squeak of the gurney wheels and the steady rhythm of the portable monitors tracking the patient's vital signs. General Morrison had chosen to accompany them to radiology, a decision that seemed to surprise the hospital staff. Sarah had never seen a general take such direct interest in the medical details of a case, but she was grateful for his presence. Without his intervention, she knew that Sergeant Thompson would still be lying in the emergency room receiving what she believed to be inadequate treatment. Dr. Henderson and Dr. Webb had also joined the procession, though their body language suggested they were far from happy about the situation. Sarah could feel their skeptical gazes boring into her back as they walked, and she tried to block out the voice in her head that whispered about what would happen if the scan came back normal. When they reached the radiology department, Sarah was relieved to see Dr. Lisa Park, the chief radiologist, waiting for them. Dr. Park was one of the few senior staff members who had always treated Sarah with professional respect, and she had a reputation for being both thorough and efficient. Dr. Chen, Dr. Park greeted her as they transferred Sergeant Thompson to the CT scanner table. I understand you're concerned about pulmonary embolism? Yes, Sarah replied, grateful to be discussing the medical details rather than the political implications of her decision. Sergeant Thompson has a history of knee surgery 6 weeks ago, and he's presenting with chest pain, shortness of breath, and declining oxygen saturation. His symptoms have been progressively worsening despite oxygen therapy. Dr. Park nodded as she reviewed the patient's chart. The contrast is ready, and we can begin the scan immediately. Given his breathing difficulties, we'll work as quickly as possible. As the CT scanner hummed to life, Sarah found herself standing next to General Morrison in the observation area, watching through the glass as Sergeant Thompson was positioned for the scan. The general had been quietly observing everything, but now he turned to address her directly. Dr. Chen, can I ask you something? Sarah nodded, unsure of what was coming next. How long have you been practicing medicine? I completed my residency 8 months ago, General. I've been working here for 3 weeks. General Morrison's eyebrows rose slightly. So you're relatively new to this. Sarah felt her heart sink. Was the general having second thoughts about supporting her decision? Yes, sir, but I had extensive training during my residency, and I've seen cases of pulmonary embolism before.
I'm not questioning your qualifications, Dr. Chen. I'm actually impressed by your conviction.
In my experience, it takes courage to stand up for what you believe is right, especially when you're facing opposition from people with more experience than you have.
Sarah looked at him with surprise. General, can I ask why you supported my recommendation?
You don't know me, and you heard 3 other doctors disagree with my assessment. General Morrison was quiet for a moment, watching as the CT scanner continued its work. Dr. Chen, I've been in the military for over 30 years. I've learned that experience is valuable, but it's not the only thing that matters.
Sometimes the newest person in the room sees things that the veterans have stopped noticing.
Sometimes fresh eyes catch what tired ones miss. He paused, turning to face her directly. But, more than that, I could see how much you cared about Sergeant Thompson. You weren't arguing because you wanted to be right, you were arguing because you genuinely believed his life was in danger. That kind of dedication is rare, and it's exactly what I want in the doctors treating my soldiers. Sarah felt a wave of gratitude wash over her. For the first time in weeks, someone was acknowledging that her motives were pure, that she wasn't trying to show off or prove anything to anyone.
Thank you, General. That means more to me than you know.
Their conversation was interrupted by Dr. Park's voice coming through the intercom. We're finished with the scan.
I'll have preliminary images available in just a few minutes. Sarah's stomach clenched with anxiety as they waited for the results.
She knew that the next few minutes would determine not just Sergeant Thompson's fate, but her own professional future as well.
If the scan showed a pulmonary embolism, she would be vindicated.
If it came back normal, she would have to face the consequences of challenging her supervisors and being wrong. Dr. Henderson and Dr. Webb had remained noticeably quiet during the scanning procedure, but Sarah could feel the tension radiating from them as they waited for the results. She wondered if they were hoping she would be proven wrong, or if they were genuinely concerned about being right and potentially having missed a serious diagnosis. Images are up, Dr. Park announced, and everyone gathered around the computer monitors where the CT angiogram images were displayed. Sarah's heart was pounding as Dr. Park began scrolling through the images, examining each slice of Sergeant Thompson's chest with practiced precision. The black and white images showed the intricate details of his lungs, blood vessels, and surrounding structures, but Sarah knew it would take an expert eye to identify any abnormalities. Here, Dr. Park said suddenly, stopping at one particular image.
Do you see this?
Sarah leaned closer to the monitor, and her breath caught in her throat. There, clearly visible on the screen, was exactly what she had feared. A large blood clot was blocking one of the major pulmonary arteries in Sergeant Thompson's right lung. That's a significant pulmonary embolism, Dr. Park continued, pointing to the obstruction. It's blocking approximately 60% of the blood flow to the right lower lobe.
This is definitely a medical emergency.
The silence in the room was deafening. Sarah felt a mix of vindication and horror. She had been right about the diagnosis, but that meant Sergeant Thompson was in even more danger than she had initially realized. Dr. Henderson was the first to speak, his voice subdued.
Dr. Chen, you were absolutely right. I owe you an apology.
But Sarah barely heard him. She was already focused on the next challenge, getting Sergeant Thompson the treatment he needed as quickly as possible. Dr. Park, we need to get him back to the ICU immediately and start him on anticoagulation therapy.
A clot this large might also require thrombolytic therapy or even surgical intervention.
Agreed, Dr. Park said, already reaching for the phone to call for transport back to the intensive care unit. I'll make sure these images are immediately available to whoever takes over his care. As they prepared to move Sergeant Thompson back to the ICU, General Morrison approached Sarah again.
Dr. Chen, what happens next?
We need to start treatment immediately to prevent the clot from getting larger and to help dissolve the existing clot. The good news is that we caught it before it caused any permanent damage.
With proper treatment, Sergeant Thompson should make a full recovery.
General Morrison nodded, but his expression was serious.
And if you hadn't insisted on the CT scan?
Sarah didn't want to think about that scenario, but she knew the general deserved an honest answer. If the clot had continued to grow or if pieces had broken off and traveled to other parts of his lungs, it could have been fatal. Pulmonary embolism is one of the leading causes of sudden death in hospitals because it's often missed or diagnosed too late. The transportation back to the ICU was a blur of activity. Sarah coordinated with the ICU staff to ensure that Sergeant Thompson was immediately started on appropriate medications, while Dr. Henderson and Dr. Webb worked on arranging for a consultation with the cardiovascular surgery team in case more aggressive intervention was needed. As they transferred Sergeant Thompson to his ICU bed and connected him to the monitoring equipment, Sarah could already see improvements in his condition. His oxygen saturation was beginning to stabilize, and his breathing seemed less labored. The anticoagulation medication was already working to prevent the clot from growing larger, and the oxygen therapy was helping to compensate for the reduced blood flow to parts of his lungs. His vitals are looking much better, observed Nurse Williams, who had followed them up to the ICU. Blood pressure is coming up, and his heart rate is starting to normalize. Sarah felt a profound sense of relief watching Sergeant Thompson's condition improve. This was why she had become a doctor. To make a difference in people's lives, to use her knowledge and skills to help others when they needed it most. Dr. Henderson approached her as she was reviewing Sergeant Thompson's medication orders.
Dr. Chen, I want to speak with you privately when you have a moment. Sarah nodded, expecting another lecture about protocols or teamwork.
She finished her review of the patient's care plan and followed Dr. Henderson to a quiet corner of the ICU.
Dr. Chen, he began, and Sarah was surprised to hear genuine humility in his voice. I want to apologize for my behavior today. You were absolutely right about Sergeant Thompson's condition, and I was wrong to dismiss your concerns.
Sarah was taken aback by the direct apology. She had expected criticism or begrudging acknowledgement, not a straightforward admission of error.
Dr. Henderson, we all make mistakes. The important thing is that Sergeant Thompson is getting the treatment he needs now.
No, Dr. Chen, it's more than that. I realized today that I've been treating you unfairly because of your age and experience level, rather than evaluating your medical knowledge and clinical judgment on their own merits. That was wrong of me, and it nearly cost a patient his life. Sarah could see that the admission was difficult for Dr. Henderson, and she appreciated his honesty.
I understand that it can be challenging when new doctors come in with different perspectives.
I never intended to be disruptive or difficult.
You weren't being difficult, Dr. Chen.
You were being thorough and advocating for your patient. Those are exactly the qualities we should want in our physicians, regardless of their age or experience level. Dr. Henderson paused, looking towards Sergeant Thompson's bed where the patient was now resting comfortably, his vital signs stable and improving. I've been practicing medicine for over 25 years, he continued. I've seen a lot of young doctors come through this hospital, and I've developed some assumptions about inexperience and overconfidence. But today reminded me that experience can sometimes make us complacent. We can become so focused on common diagnoses that we stop considering other possibilities. Sarah listened carefully, recognizing that this conversation represented a turning point in their professional relationship. Dr. Henderson, I want you to know that I respect your experience and knowledge. I wasn't trying to undermine your authority, I was just trying to make sure we didn't miss anything important.
I know that now, Dr. Chen.
And I want you to know that from this point forward, your opinions and recommendations will be given the same consideration as those of any other physician on our staff.
You've earned that respect.
As their conversation concluded, Sarah felt a weight lifting from her shoulders. The constant tension and self-doubt that had plagued her for the past 3 weeks was beginning to fade, replaced by a renewed confidence in her abilities and her place on the medical team.
But the day wasn't over yet.
As she returned to Sergeant Thompson's bedside to check on his progress, Sarah noticed that General Morrison was still in the ICU, speaking quietly with some of the nursing staff. When he saw her approach, he walked over to join her.
Dr. Chen, how is Sergeant Thompson doing?
Much better, General. The anticoagulation therapy is working, and his vital signs have stabilized. We'll need to monitor him closely for the next 24 to 48 hours, but I expect him to make a full recovery." General Morrison nodded, relief evident in his expression.
"Thanks to your persistence. If you hadn't pushed for that CT scan..."
"I was just doing my job, General. Any good doctor would have done the same thing."
"No, Dr. Chen, that's not true.
A lot of doctors would have gone along with the consensus to avoid conflict. You put your patient's welfare above your own comfort, and that takes real character." Sarah was touched by the general's words, but she was also aware that this experience had taught her important lessons about standing up for her convictions and trusting her clinical judgment.
"General, can I ask you something? Why do you take such personal interest in the medical care of your soldiers?"
General Morrison's expression grew more serious. "Dr. Chen, when you're responsible for sending people into dangerous situations, you feel a tremendous obligation to make sure they get the best possible care when they're hurt or sick. These men and women put their lives on the line for their country.
The least we can do is make sure they get excellent medical care when they need it."
He paused, looking towards Sergeant Thompson. "But, beyond that, I've learned that the quality of medical care often depends on the willingness of doctors and nurses to speak up when they see something wrong. In the military, we call it having the moral courage to do the right thing, even when it's difficult." As the afternoon progressed, word of the successful diagnosis and treatment began to spread through the hospital. Sarah found that her interactions with other staff members had subtly changed. The polite skepticism had been replaced by genuine respect, and she began to feel like she was truly part of the medical team rather than an outsider trying to prove herself. Dr. Webb even approached her later in the day to acknowledge that she had been right about Sergeant Thompson's condition. While his apology was less heartfelt than Dr. Henderson's, Sarah appreciated the gesture nonetheless. But perhaps the most meaningful moment came when Sergeant Thompson himself regained enough strength to speak with her. As she was checking his evening vital signs, he grabbed her hand with surprising strength. "Dr. Chen," he said, his voice still weak but clear.
"The nurses told me what happened today. They said you fought to get me the right treatment even when other doctors disagreed."
Sarah felt tears forming in her eyes.
"I just did what any doctor should do, Sergeant Thompson. I'm glad you're feeling better."
"No, ma'am, you did more than that. You saved my life, and I won't forget it." As Sarah left the hospital that evening, she reflected on the extraordinary day she had experienced. She had faced her biggest professional challenge yet and had emerged stronger and more confident. More importantly, she had saved a life and earned the respect of her colleagues. But she also knew that this was just the beginning. The real test would be whether the changes in attitude would last, and whether she would continue to have the courage to speak up for her patients when the situation demanded it. As she walked to her car under the setting sun, Sarah felt a sense of accomplishment and purpose that she had been missing for the past 3 weeks. She was finally beginning to feel like the doctor she had always wanted to be. 3 days had passed since the incident with Sergeant Thompson, and Sarah was beginning to notice a significant shift in the hospital's atmosphere. The change wasn't dramatic. Hospitals were still serious, fast-paced environments where life and death decisions were made every day, but there was a subtle difference in how people treated her. The morning rounds that had once felt like interrogations now felt more like collaborative discussions. When Sarah offered opinions or suggestions, they were met with genuine consideration rather than polite skepticism. Dr. Henderson, in particular, seemed to go out of his way to include her in decision-making processes and to ask for her input on challenging cases. But perhaps the most unexpected development was the relationship that had begun to form between Sarah and General Morrison. The general had made it clear that he wanted to be personally updated on Sergeant Thompson's recovery, and his frequent visits to the hospital had led to several conversations with Sarah about military medicine and patient care. On this particular morning, Sarah was reviewing lab results when Patricia approached her with a message. "Dr. Chen, General Morrison would like to speak with you when you have a moment."
"He's in conference room A."
Sarah nodded, finishing her review of the blood work before making her way to the conference room. She found General Morrison standing near the window, looking out at the hospital's courtyard where she had made her phone call to Emma just a few days earlier.
"General Morrison, you wanted to see me?"
He turned from the window with a slight smile. "Dr. Chen, please, have a seat."
I wanted to talk to you about something important.
Sarah sat down, curious about what the general might want to discuss. Their previous conversations had focused primarily on Sergeant Thompson's care and general topics related to military medicine. "How is Sergeant Thompson doing today?" he asked, taking the seat across from her. "Excellent," Sarah replied with genuine enthusiasm. "His oxygen levels are back to normal. The follow-up CT scan shows that the clot is resolving well with the anticoagulation therapy, and he should be ready for discharge tomorrow. He'll need to continue the blood thinners for several months, but his prognosis is very good." General Morrison nodded with evident satisfaction.
"That's wonderful news.
"Dr. Chen, I want you to know that what happened 3 days ago has had a significant impact, not just on Sergeant Thompson, but on this entire hospital."
Sarah looked at him with surprise. "What do you mean, General?"
"I mean that your willingness to stand up for what you believed was right, even in the face of opposition from senior physicians, has sent a message throughout this institution.
It's reminded people that good medicine isn't about hierarchy or politics, it's about putting patients first."
The general leaned forward slightly, his expression becoming more serious.
"But that's not the only reason I wanted to speak with you today. I have a proposition for you."
Sarah felt a flutter of curiosity mixed with apprehension.
"What kind of proposition? Dr. Chen, how familiar are you with military field medicine?"
The question seemed to come out of nowhere, and Sarah took a moment to gather her thoughts. "I have some theoretical knowledge from my medical school courses, but no practical experience."
"Why do you ask?"
General Morrison stood up and moved back toward the window, his hands clasped behind his back in a military posture. "The Army is developing a new program to improve medical care for soldiers in combat zones and remote locations. We're looking for exceptional physicians who can adapt quickly to challenging environments and who have the courage to make difficult decisions under pressure." Sarah was beginning to understand where this conversation was headed, and her heart started beating faster.
"The program involves specialized training in battlefield medicine, trauma surgery, and emergency care in resource-limited environments.
Selected physicians would serve as medical advisors to military units and would be responsible for providing advanced medical care in situations where traditional hospital resources aren't available." He turned back to face her.
"Based on what I observed 3 days ago, I believe you would be an excellent candidate for this program." Sarah was speechless for several moments.
The opportunity sounded both exciting and terrifying, and she wasn't sure how to respond.
"General, I'm honored that you would consider me for something like this, but I have to ask, why me? Surely there are military physicians with more experience who would be better suited for this kind of role." General Morrison smiled.
"Dr. Chen, experience is valuable, but it's not the only quality we're looking for. We need physicians who can think independently, who aren't afraid to challenge conventional wisdom when necessary, and who have the moral courage to do what's right even when it's difficult." He paused, moving closer to the table. 3 days ago, you demonstrated all of those qualities. You saw something that more experienced physicians missed, you had the courage to argue for what you believed was right, and you were willing to put your career on the line for a patient's welfare. Those are exactly the qualities we need in this program."
Sarah felt a mix of excitement and uncertainty.
The opportunity sounded incredible, but it would also mean leaving behind the civilian career she had worked so hard to build.
"What would this involve, exactly? Would I have to leave my position here at the hospital?"
The initial training would take approximately 6 months and would be conducted at various military medical facilities. After that, you would be assigned to work with specific military units, providing medical support during training exercises and, if necessary, during actual deployments.
General Morrison sat back down across from her.
"You would maintain your civilian status. This isn't about joining the military. It's about using your skills to serve soldiers who put their lives on the line for their country. And the experience you would gain would be invaluable for your civilian career as well." Sarah was intrigued, but she also had practical concerns.
"What about my position here?
I just started working at this hospital, and I don't want to abandon my responsibilities here."
"That's something we would work out."
The program is designed to be flexible, recognizing that participating physicians have civilian careers and obligations. We might be able to arrange for you to maintain a part-time position here while also participating in the military program. The offer was tempting, but Sarah knew she needed time to think about it carefully. General, this sounds like an incredible opportunity, but it's also a major decision.
Can I have some time to consider it?
Of course.
This isn't a decision that should be made lightly. Take all the time you need.
But I will say this, opportunities like this don't come along very often, and I think you would excel in this role. As their conversation concluded, Sarah's mind was racing with possibilities and questions. The opportunity to work in military medicine would provide experiences and training that she could never get in a civilian hospital. It would also be a chance to serve her country and to use her skills to help soldiers who risked their lives for others. But it would also mean stepping into an even more challenging environment than the one she was just beginning to navigate successfully. Military medicine would involve not just medical challenges, but also the additional pressures of working in potentially dangerous situations with limited resources. The rest of the day passed in a blur as Sarah tried to process the general's offer while still focusing on her regular duties. She found herself paying closer attention to the military patients in the hospital, trying to imagine what it would be like to provide care in field conditions rather than in the controlled environment of a modern medical facility.
During lunch, she called Emma to discuss the opportunity.
"Wow, Sarah, that sounds amazing," Emma said after Sarah had explained the general's offer.
"But, are you sure you're ready for something like that? You've only been working at the hospital for 3 weeks.
"I know it seems crazy," Sarah replied. "But, Emma, what happened with Sergeant Thompson made me realize something important about myself. I'm not just good at medicine, I'm good at making difficult decisions under pressure.
Maybe this is exactly the kind of challenge I need."
"But, what about your career at the hospital? You've worked so hard to get to where you are."
Sarah had been thinking about the same question all morning.
"That's just it, Emma. 3 days ago, I felt like an outsider at this hospital. Now I feel like I'm finally being accepted, but is that enough? Should I be satisfied with just fitting in, or should I be looking for opportunities to really make a difference?"
Emma was quiet for a moment. "You know what, Sarah? You've never been the kind of person who takes the safe route. You've always been willing to take risks if you believed they were worth it. Maybe this is one of those times. You think I should do it?"
"I think you should do whatever feels right to you. But I also think that General Morrison is right, opportunities like this don't come along very often.
If you don't take it, you might always wonder what could have been."
That evening, Sarah found herself back in the hospital's courtyard, sitting on the same bench where she had made that phone call to Emma just a few days earlier. The contrast between how she felt now and how she had felt then was striking. 3 days ago, she had been questioning her place at the hospital and wondering if she had made a mistake in choosing to work there. Now, she was being offered an opportunity that could change the entire direction of her career. As she sat in the quiet of the evening, Sarah reflected on the events that had led to this moment. Sergeant Thompson's case had been a turning point, not just in her relationship with her colleagues, but in her understanding of her own capabilities and potential. She thought about General Morrison's words about moral courage and the importance of doing what was right even when it was difficult. She had demonstrated those qualities in advocating for Sergeant Thompson, but the military program would require her to demonstrate them on a much larger scale and in much more challenging circumstances.
The next morning brought another surprise.
Sarah was making her usual rounds when she encountered Sergeant Thompson, who was preparing for his discharge from the hospital. He was dressed in his military uniform rather than a hospital gown, and he looked remarkably healthy considering his condition just 4 days earlier. "Dr. Chen," he said when he saw her approaching. "I was hoping I'd get a chance to speak with you before I left."
"Sergeant Thompson, you look wonderful. How are you feeling?"
"Like a new man, thanks to you." He paused, his expression becoming more serious. "Doctor, I heard that General Morrison offered you a position in the new military medical program." Sarah was surprised that word of the offer had already spread, but she supposed that in a military hospital, news traveled quickly.
He did mention an opportunity, yes. Dr. Chen, I want you to know that if you decide to take that position, you'll be working with some of the finest people in the world.
Military medicine is challenging, but it's also incredibly rewarding.
You'd be making a difference in the lives of people who are willing to sacrifice everything for their country.
Sergeant Thompson extended his hand to shake hers.
Whatever you decide, I want to thank you again for saving my life.
Your courage and determination are exactly what we need in military medicine. As Sarah watched Sergeant Thompson leave the hospital, she felt a sense of completion regarding his case, but also a growing sense of clarity about her own future. The conversation with him, combined with her discussions with General Morrison and Emma, was helping her to see the decision more clearly. Later that afternoon, Sarah received a call asking her to come to Dr. Henderson's office. She found him waiting for her with a serious expression, and, for a moment, she wondered if there was some new challenge or criticism coming her way.
Dr. Chen, please sit down. I understand that General Morrison has offered you a position in a new military medical program.
Sarah nodded, wondering how Dr. Henderson felt about potentially losing a physician so soon after she had started working at the hospital.
I want you to know that while we would certainly hate to lose you here, I think this could be an incredible opportunity for you. The experience you would gain in military medicine would make you an even better physician, and the program would benefit enormously from having someone with your skills and dedication. Sarah was touched by Dr. Henderson's support, especially considering their rocky relationship just a few days earlier. Dr. Henderson, I appreciate your encouragement.
But I'm also concerned about leaving the hospital when I've only been here for such a short time. Dr. Chen, one of the things I've learned in my years of practice is that sometimes the best opportunities come when you least expect them. You've already proven yourself here, and you've made a significant impact on our approach to patient care.
If this is something you want to do, I would encourage you to pursue it.
As Sarah left Dr. Henderson's office, she realized that the decision was becoming clearer in her mind. The support she was receiving from her colleagues, the potential to serve her country, and the opportunity for professional growth were all pointing in the same direction. That evening, she made another phone call to Emma.
I think I've made my decision. Let me guess, you're going to take the military position. Sarah laughed. Am I that predictable? You're not predictable, Sarah. You're just true to yourself.
You've never been satisfied with just doing good work, you've always wanted to make a real difference in the world. This sounds like an opportunity to do exactly that. As Sarah hung up the phone, she felt a sense of peace about her decision. Tomorrow, she would call General Morrison and accept his offer. She was stepping into the unknown once again, but this time, she was doing it with confidence in her abilities and a clear sense of purpose. The young doctor who had felt like an outsider just a week ago was about to embark on an adventure that would test her skills, courage, and dedication in ways she couldn't yet imagine. 6 months later, Dr. Sarah Chen stood in the middle of a makeshift medical tent in the mountains of Colorado, her hands steady as she sutured a training wound on a soldier's arm. The tent was a far cry from the sterile operating rooms of St. Matthew's Military Medical Center, but Sarah had learned to adapt to working in conditions that would have seemed impossible just half a year earlier. The military medical training program had been everything General Morrison had promised and more. Sarah had spent weeks learning emergency field surgery, trauma medicine, and how to provide advanced medical care with limited resources. She had trained in desert conditions, Arctic environments, and urban warfare scenarios, each presenting unique challenges that had pushed her skills to their limits. But, more than the technical training, the program had taught her about leadership, decision-making under pressure, and the unique responsibilities that came with caring for soldiers who put their lives on the line every day. She had learned to work with military personnel who came from diverse backgrounds and experiences, and she had developed a deep appreciation for the dedication and sacrifice that characterized military service. Dr. Chen, we've got a situation developing over at Training Area Charlie, called Sergeant First Class Maria Rodriguez, the senior medic who had become Sarah's closest collaborator during the training exercises.
Multiple casualties from a simulated IED explosion. They're requesting immediate medical support.
Sarah immediately switched into emergency mode, the familiar rush of adrenaline focusing her attention on the task ahead. This was what the training had been preparing her for, the ability to provide life-saving medical care in chaotic, dangerous situations where every second counted.
How many casualties?
Sarah asked as she grabbed her medical pack and checked to ensure it contained all the supplies she might need. Reports indicate 4 soldiers down, with at least 2 serious injuries. Ground transport is limited due to the simulated combat situation, so we'll be going in by helicopter. Sarah nodded, her mind already running through treatment protocols and triage procedures. The helicopter medical evacuations had been among the most challenging aspects of her training, requiring her to provide care in a cramped, noisy environment while dealing with the motion and vibration of flight. As they made their way to the helicopter landing zone, Sarah reflected on how much her life had changed since accepting General Morrison's offer. The decision to leave her comfortable position at the hospital had not been easy, but it had led to experiences and opportunities she never could have imagined. The first few weeks of training had been particularly difficult. Learning to work in field conditions had required her to unlearn many of the assumptions she had developed about medical practice. In a hospital, she had access to sophisticated diagnostic equipment, extensive pharmaceutical resources, and the support of numerous specialists. In military field medicine, she often had to make critical decisions based on limited information and provide treatment with whatever supplies were available.
But the challenges had also been incredibly rewarding.
Sarah had discovered that she thrived in high-pressure situations and that her ability to think quickly and adapt to changing circumstances made her well-suited for military medicine. The training had pushed her to become a more resourceful, confident physician, and she had gained skills that would serve her well regardless of where her career took her in the future. The helicopter ride to training area Charlie took only 10 minutes, but it gave Sarah time to mentally prepare for whatever she might encounter. The simulated casualties would be portrayed by actors with realistic-looking injuries, designed to test her ability to provide care under realistic combat conditions. As the helicopter touched down in a cloud of dust and rotor noise, Sarah could see the training scenario unfolding ahead of her. Several soldiers were lying on the ground near what appeared to be the remains of a military vehicle, while others were providing security and calling for medical assistance. Sarah and Sergeant Rodriguez immediately moved toward the casualties, their training taking over as they began the process of triage and treatment. The first soldier they reached was conscious but had significant simulated injuries to his legs. Sarah quickly assessed his condition and began applying tourniquets to control the bleeding.
"Sergeant, can you hear me?" she asked as she worked. "What's your name?"
"Johnson," the soldier replied, his voice showing the strain of his simulated pain.
"It hurts pretty bad, document." "You're going to be fine, Johnson."
"I'm going to get you stabilized and, then, we'll get you out of here." As Sarah worked on Johnson's injuries, she could hear Sergeant Rodriguez attending to other casualties nearby. The scenario was designed to test their ability to work as a team while managing multiple serious injuries simultaneously. The most challenging case was a soldier who was unconscious and had simulated head injuries. Sarah had to quickly determine whether he had a traumatic brain injury that would require immediate surgical intervention, or if his unconsciousness was due to other factors that could be managed with conservative treatment. Using the diagnostic skills she had developed during her training, Sarah was able to determine that the soldier's condition was stable enough for transport but would require close monitoring during evacuation. She coordinated with the helicopter crew to ensure that he would receive appropriate care during the flight to the base hospital. The entire exercise took less than an hour, but it required the full range of skills that Sarah had developed during her 6 months of training. When it was over and the casualties had been successfully evacuated, she felt the familiar sense of accomplishment that came with successfully managing a challenging medical situation. "Outstanding work, Dr. Chen," said Colonel Williams, the officer in charge of the training exercise. "Your triage decisions were excellent, and your treatment protocols were exactly what we would want to see in a real combat situation." Sarah thanked the colonel for his feedback, but her attention was already turning to the next phase of her training.
Tomorrow would mark the end of the formal training program, and she would be receiving her first assignment to work with an active military unit.
That evening, as Sarah was reviewing her performance during the day's exercise, she received an unexpected visitor at her quarters. General Morrison knocked on her door, carrying a folder that she assumed contained her next assignment.
"Dr. Chen, do you have a few minutes?"
I wanted to discuss your assignment and to talk about how the training program has gone.
Sarah invited the general in and offered him a seat.
Over the past 6 months, their relationship had evolved from the formal interaction of their first meeting to a more collegial partnership. General Morrison had taken a personal interest in her progress through the training program, and Sarah had come to appreciate his guidance and mentorship. General, I have to say that this training has been the most challenging and rewarding experience of my medical career. I feel like I've grown tremendously as a physician, and I'm confident that I can provide excellent care to soldiers in any environment.
General Morrison smiled. I'm glad to hear that, Dr. Chen.
Your instructors have provided glowing reports about your performance, and I believe you're ready for your first field assignment. He opened the folder and handed her a document with official military letterhead.
You'll be assigned to work with the 82nd Airborne Division at Fort Bragg.
They're preparing for a deployment to provide humanitarian medical assistance in a region that's been affected by natural disasters.
It's exactly the kind of mission where your skills will be most valuable.
Sarah felt a surge of excitement as she read through the assignment details. The deployment would involve providing medical care to civilian populations in areas where the local healthcare infrastructure had been damaged or destroyed.